Hey guys and gals, Salim Rezai here. I'm the creator and founder of Rebel EM and the medical director of IA Med. And in this video, we're going to be talking about the importance of professionalism. Now, I know this is kind of a boring topic and one that is probably not one that gets talked about frequently, but I think it's important that we talk about it. And the reason is that professionalism, what that does for patients, it makes the patient the center of our care when we're being professional. It provides equitable care because if we can reproduce and do the same thing every time, then we're giving everyone the same care. And ultimately, it builds trust with the patient. Now, I like constructs, and the construct I like to use when thinking about professionalism and bedside manner is this concept of clear. And so each letter stands for something. C is for connecting with the patient, L is for listening to the patient, E is for explaining to the patient, A is asking questions, and then R is coming back and reconnecting with the patient. So what does this kind of look like? Well, for the connection, we want to make sure we're using the patient's name. We want to make eye contact. Sometimes we're so busy doing things we forget to do that. We want to say who we are. We want to be very clear in terms of who we are and what we do. And then we also want to be calm because a lot of these patients are going to be very anxious. We want to listen. Don't interrupt. Let the patient kind of give their spiel about what happened or the family member about what happened. And then repeat the info to make sure that we're getting the most accurate information. Explain. Describe what will happen going forward. Make sure that we answer questions that the patient or the family may have. Then we can ask questions. We want to confirm that all their questions are answered. We want to make sure the patient and the family understands what is going on and how serious the situation is. And then we want to reconnect. We want to check back. So we do a lot of things for patients and we want to make sure that what we've done has helped. So for example, the patient says they're having 10 out of 10 chest pain and we gave them morphine and we gave them nitroglycerin and aspirin. We want to recheck and make sure that their pain is doing better, is it doing worse, or if it's still doing the same. So this is kind of a nice construct to kind of keep that bedside manner, keep that professionalism with the patient. I want to leave you with a final thought when it comes to professionalism because I know this is kind of a boring topic. But remember, the patient's the one that has the disease. And when they see us, it's usually one of the worst days of their lives. And sometimes even I forget that, and it's nice to have that reminder about what we do actually matters and why it's so important that we remain professional with patients and their families. Well, there you have it, the importance of professionalism. Let me know your thoughts, comments, and questions. Thank you as always, and until next time.